Level 1. Lab Tech. Hired at Chemistry Lab White Plains, $38,000 yearly. More than the warehouse job. Less than your student loans, $87,000. The facility is sterile and modern, nothing like you imagined. Day 2, Dr. Reeves pulls you aside in the break room. She's been here 12 years. Never ask about certain compounds, she says. There are rooms you don't go into, notebooks you don't read. She doesn't explain why. You get the message. 3 weeks in, you're assigned to test Valixin, pain medication the company markets as non-addictive. The tests show dependency potential at high doses, clear signal. You log the numbers. Your supervisor sees the results. He tells you the protocol might be flawed. He sends you a new one. You follow it exactly. Same test, different steps. Numbers are lower now. He nods. You walk back to your station in the lab. Your hands are shaking slightly. You realize what just happened. You falsified data. Your supervisor didn't order it explicitly. Nobody said lie. You just adjusted the protocol because you were told the original was flawed. The results are lower now, and that's what matters. You tell yourself everyone does this. You tell yourself the drug is probably fine anyway. You need the job, more than you need to be right about this. You log the new numbers. You say nothing. Month later, Valixin is approved. Marketing projects $2.3 billion in first-year sales. You see it in a hallway memo. Smiling older woman, headline, relief has arrived. You know what the drug actually does. You know what you didn't tell anyone. You keep preparing reagents. You keep logging numbers. You're building a skill now, not chemistry, rationalization. The first step is always the easiest. Level 2, clinical trial coordinator. 3 years in, promotion to clinical operations, $58,000 a year. You move to Stamford Office Park. You're coordinating Phase 3 trials for Trozide, a cardiac medication. 23 medical centers across 8 states. Your job is enrollment, monitoring, data integrity. Your real job is keeping sites compliant. Sites that enroll fast get rewarded. Sites that ask questions about side effects get squeezed. The investigators know you can find another site. They enroll fast. Week 1, 12 patients. Week 3, 47. Week 6, 103. 3 months in, Dr. Chen in Atlanta emails. 6 dizziness, 2 irregular heartbeats, 1 stroke. Not in the protocol. She wants to hold enrollment. You call your supervisor. He calls the medical director. The director tells you these events are statistically expected, within normal range. He gives you talking points. You call Dr. Chen back. Her site gets $2,500 per enrolled patient. You don't mention this. You mention the 400 other patients counting on this medication. There's a pause on the line. She knows what you're not saying. She agrees. She keeps the site open. By month 5, 14 serious adverse events across all sites. Internal Safety Committee decides Trozide continues. Cardiovascular events get mentioned in fine print. The aspirin interaction gets buried. If taken with aspirin, ibuprofen, or blood pressure drugs, the risk multiplies. Most patients won't know. Most doctors won't notice. FDA approval in 9 months. TV commercials. Man jogging by river, woman dancing. Relief and hope. No interactions mentioned. No stroked patients. Your bonus, $3,000. Pay student loans. Next assignment accepted. Pattern is normal now. Harm is a line item. Level 3, medical science liaison. 5 years in, promoted to medical science liaison. $84,000 plus performance bonus. You're selling trials now. Territory covers Connecticut, Massachusetts, Rhode Island, 30 doctors each month. You bring free lunches. The data is real. The presentation isn't. Scripts written by lawyers and marketing never mention the aspirin interaction, never mention stroke cases, mention uncommon adverse events, vague enough to mean nothing. Dr. Marcus nods and prescribes Trozide. 6 months in, you visit a cardiologist at Rhode Island Hospital on the 4th floor, discussing glucogain, new diabetes drug. Data shows 23% blood sugar improvement. 7 patients developed pancreatic inflammation. Safety Committee decided they were rare idiopathic cases. 2 committee members. Paid consultants for your company. Don't mention. Cardiologist writes prescriptions. 2 weeks later, see hospital bill. Patient paid $14,000 out of pocket. Your commission, $240. You start noticing patterns. One doctor in Stanford mentions side effects. You shift to a different drug. He changes subject. Next month, when you mention his name is in the top prescriber list, his eyes shift. He prescribes more. They trust you. Doctors want lunches, speaking fees, funded research. Everyone benefits except patients who don't know side effects were hidden. Month 8, $4.2 million glucogain sales. Bonus, $18,000. Salary, $96,000. Train new liaisons. Teach the scripts. Teach them to smile while omitting facts. By month 1, they believe it. Level 4, regional manager. Regional manager, $138,000 plus bonus. Manage 14 liaisons Northeast. Access special notes tracking doctors who object to side effects or demand unedited data. These doctors are marked, reassigned when rotations happen, filtered out. You realize what you've been part of. Vegas conference, 200 from 40 companies. Speaker talks problematic physicians, those asking about side effects. Solution, reallocation. 50 million patients in region only need a fraction. Focus cooperative doctors. Let problematic ones prescribe less. Build spreadsheet in Boston. High value, 12. Bi-weekly visits, monthly lunches, $5,000 grants. Standard, 8, 4 visits yearly. Development, 5. 1 visit, reallocation if prescribing doesn't increase. Call it resource optimization. Michael asks if withholding access based on prescribing is allowed. You call him into your office. Standard practice, you say. Other companies are hiring if he has concerns. He looks at your desk. He looks back at you. He nods. He implements the spreadsheet without another word. 18 months. FDA 240 stroke reports on trazide-aspirin interaction. Legal meeting. Warning label costs $650 million sales over 3 years. Fund research questioning link instead. Approve $8.2 million research support. Paying for doubt. Trazide hits $3.8 billion sales. Bonus, $260,000. Age 38, house, Tesla, stable, 401k. 12 liaisons depend on your targets. Speak up, lose everything, stay silent. 240 families keep losing. You choose money, chosen at 12 years. One more choice doesn't feel like choice anymore. Level 5, Senior Director Medical Affairs, New Jersey. Senior Director Medical Affairs, $220,000, $180,000 bonus, stock vesting 4 years. Manage 8 regional managers, 112 liaisons. Influence which studies funded, which data published, which events reported. The chief medical officer calls you into his office. He's decided to let you manage the glucogain label update. This is the highest compliment. You're being trusted with problem management. Adverse events become data points to manage. Data points become statistical probabilities. Probabilities become acceptable risk. Glucogain label decision. Pancreatic inflammation, undeniable. 400 cases. Warn now or wait 6 months funding studies? 6-month sales. $240 million. Lawsuit defense, $18 million. Approved delay. Calculate sufferings cost, call it business. Sleep fine. FDA scrutiny increasing, Congress asking. Lobbying firm, $2.1 million annually. Meeting with lobbyists and CLO. Don't fight FDA, control conversation. Fund their research, create their evidence. A CBER regulator about to recommend warning. Offer her consulting, $10,000 per day. No explicit quid pro quo, just future opportunity. She retires. Friendlier arrives. San Francisco keynote. Talk innovation, hope, rigorous science. Don't mention pancreatic cases. Doctors applaud. Cite presentation. Reaches 2,000 physicians influencing 10,000 prescriptions. FDA quiet meeting requests trazide study, not warning study. Already funded selected investigators, written protocol, guarantees no causal link. FDA reviews, safe, closes investigation. Memo. FDA concludes trazide safety profile. Technically true. Doesn't say you designed conclusion beforehand. Press release. Stock up. Options. $840,000. Level 6. Vice President, Global Development. VP Global Development. $380,000, $300,000 bonus, stock compounding, executive floor, Hudson River View, manage 340 across 40 countries, board, return on investment, CFO, quarterly growth, not implementing system anymore, you are system, Neurolog series, Neurolog A, depression, B, anxiety, C, bipolar. Same compound, 3 markets, triple revenue. Trials show improvement matching existing drugs. 12 weeks maximum duration. Long-term data messy. Withdrawal, sexual dysfunction. Emotional blunting invisible at 12 weeks. Short trials mean fast approval, fast revenue. Long-term harms. Someone else's problem 5 years out. Monaco Summit. Competitor CEO explains addiction strategy. Rebrand addiction as medical condition. Create treatment market. When drug kills, expand, not retreat. Find adjacent problem, monetize. Call it innovation. Take notes. Conceptualize Neurolog A withdrawal market. Develop Neurolog D, withdrawal treatment. Nobody on A knows D exists or being primed to need it. Back Jersey, assign withdrawal study to favorable CRO. Review protocol beforehand. Approve modifications. Higher control dose. Withdrawal less visible. Enroll mild patients only. Sexual dysfunction data exists but gets buried in long-term studies nobody reads. Not falsifying. Curating which data appears where. Budget, $14.4 million research support. 6 months in, research coordinator emails about unusual dropouts. Patients leaving study due to side effects. Questions protocol protection. Legal sends friendly letter. Thanks for diligence. Discussing data outside channels. Breaches confidentiality. Message clear. Quiet or life gets complicated. She's quiet. Trial continues. Level 7, Chief Medical Officer, age 52, CMO, $520,000, $400,000 bonus, board eligible. Manage 84 medications, Executive Committee, report CEO. All clinical decisions, regulatory recommendations, safety response. Not implementing anymore. Designing. Inversion of moral gravity. Trozide 15 years on market. Death toll 2,100 strokes. Settlements $3.1 billion confidential. Your job. Prevent next wave. Control narrative. Data transparency optimization. Officially make available. Actually flood noise. Commission 47 studies. Most obscure. Compare to high-dose aspirin, test age groups, economic impact. None ask. Does Trozide plus aspirin cause strokes? You know yes. Cost $18.2 million. Benefit $890 million extended life. Daughter graduated med school. Cardiology residency. Thanksgiving mentions attending prescribed Trozide to elderly aspirin patient. She's reading up. Cold in your chest. Tell her Trozide excellent, data robust. Don't tell her what you know. That stroke risk hides in combination you're actively concealing. Pass gravy, lie to daughter. Whistleblower contacts WSJ. Former coordinator, kept records, emails, protocols, excluded data. Legal plans character assassination, question history, imply fired, suggest financial motive, sign memo. If documents go public, $4 billion liability minimum. Destroy person's credibility, preserve shareholder billions. WSJ publishes Emergency Board, CEO panicked, CFO calculating, CLO plea dealing. CEO looks at you. Doctor, conscience. Say, standby safety. Say, disgruntled employee. Say, regulatory confidence. Technically defensible, not true. Board, $280 million settlement, $120 million lobbying, guidelines recommending Trozide. Bonus, $520,000. Now, teach others to lie. Level 8, Executive Vice President, Strategy. EVP Corporate Strategy, $680,000, $650,000 bonus, $2.1 million stock. Oversee acquisition, development. Determine therapeutic areas, marketing, lawsuit defense, managing acceptable harms. Congressional inquiry into Trozide. Oregon Rep presents chart 2,100 deaths. Did company know? CEO. Followed FDA guidance. True. Irrelevant. The FDA guidance was written with company lobbyists in the room. Everyone knows. Everyone denies. Fine. $620 million. Stock recovers by afternoon. Market priced it in. Boston conference. You speak on sustainable profitability in regulated markets. Talk innovation, burden investor confidence. Don't mention 2,100 deaths were sustainable for 15 years. 1,000 applaud. Your father's 79, diagnosed with heart disease. He's taken Trozide 8 years without stroke. You sit in the cardiologist's office. The doctor recommends continuing. Doesn't mention aspirin interaction because he doesn't know. You know it. Know the data. Know the risk. Your mouth opens. Close it. Say nothing. Let your father take medication you know is dangerous. Odds in his favor, you tell yourself. 3 months later, stroke. Moderate. Lost left arm function. He calls. Asks if medication caused it. You say, don't know. Very rare. Bad luck. Sister calls next. ER physician. Angry. Seen too many like father. Asks if something to tell. Don't answer. Can't. Truth means admitting you knew and said nothing. Send money instead. Pay therapy. Care. Make problem disappear. Keep secret. Become man who buys family silence. Level 9. Chief Executive Officer, CEO, age 58, $1.2 million salary, $1.8 million bonus, $18 million options, $12 million severance. Run 52,000 employees, $47 billion revenue. Control 112 million patients' decisions. No portfolio, margins, guidance, patients or statistics. Review litigation files. 847 active lawsuits. 3,200 settled cases. $18.7 billion total. Average payout per death, $4.8 million. Company bought silence. $13.4 billion non-disclosures. Secrets cheaper than truth. Shareholder meeting. 400 investors ask pipeline. Penetration, ROE. Nobody asks deaths. Answer, acquisitions in high revenue markets, long treatment windows. Applaud, calculate money. Daughter voicemail, resigning cardiology, moving doctors without borders. Can't practice in corrupted system. Can't trust guidelines. Doesn't say your name. 3 years in, announce $14 billion psychiatric acquisition. Control 34% antidepressant market. $2.1 million base plus $2.4 million bonus. Worth $240 million. 47th floor, Hudson View, age 61, 6 years to $80 million pension. 10 p.m. You're alone at your desk. Email from Regulatory Affairs. New drug next year. 8-week trials. 5-year data gap. You open the spreadsheet. $4.2 billion revenue before lawsuits. Calculate researcher payments for doubt, lobbyist fees, silence costs. Clean math. Done this 9 times. This will be 10. You don't feel anything. This is the system. It keeps running after you're gone. You close the email. Look at the river. Flicker of New Jersey lights. Close laptop. Go home. If you recognize this life, share what you saw.